Okay guys, it's 2 a.m. on day 5. I woke up at about 1:30, was in some pain enough to wake me up, and was having some what felt like acid from my stomach come up to my throat, which was making me uncomfortable. I had a little bit of wheezing also, so I felt like there was some congestion in my chest there. So I went ahead and pressed my call button, and someone came right away and helped me to get out of the bed and get clear of all the attachments so that I could walk with my stand. And I went and walked with my stand for 10 laps and was able to pass some gas along the way, which made my pressure on my stomach feel better. I feel like I have some more gas that I need to get rid of that I've been able to steer loose, which is good for my comfort. So satisfying. I mean, that's a really good sign that things are moving. So I'm really thankful for that. So now I think they're going to try to get me some Pepsid, something for the acid that's coming up, and hopefully get myself back comfortable again here shortly. But already starting off better than yesterday, so that's good. And I hope that your day is starting off good too. So we'll see how the rest of it progresses. Ooh, calling Bill Fox.
Yeah.
You had to do that?
Like Vader.
Yeah. Breathing treatment.
Yes, sir.
So, went and had a leak test done to see if I had any leaks, and there's a little bit of a leak, but it's contained, so far it's looking like it's just something kind of normal that happens when you're in a certain position. But I'll let you know a little bit more about that once I talk with the doctor and get an update. But they didn't seem to be too concerned about it, so I'm going to try to do the same. So I have a few changes today. I just showered all by myself, and it took me a while. It's tricky when you have IV ran in the middle of both arms to bathe, without compromising those. But it just takes more time. Try to keep them covered as much as you can. And main thing was I wanted to make sure that I got all that soap off of me, because if I leave that soap on my skin, it tends to dry my skin out. So, but I feel much better after the shower, except for the usual after shower pains. It just feels like I kind of stretch everything out while I'm in there. It's a weird sensation. You feel great because you're clean, but at the same time, every single place where they entered your body is just screaming at you. So, but I'm not doing the button with the morphine anymore. We're going to kind of change the regimen now to where I'm doing the Oxycontin every 4 hours, and then if I need it, I have Dilaudid available for breakthrough pain. So right now I'm going to get some ibuprofen, some Tylenol, and some Dilaudid to help ease the shower, and maybe after that I'll feel loose enough that I can take a walk and get rid of all this stuff that this breathing treatment is breaking up before I lay down. So it's just trying to carefully think out each step and what I need to do, and just take care of things one by one. The wife did call me a little while ago, and she said, well, she texted me and she said that she had sold the dirt bike. So that's good. I was thinking that we'd get that sold before Christmas. I hate that I had to let it go, but at the same time, I'm glad that it's there because, you know, if you haven't heard, cancer is very expensive. So, but I'm gonna try to relax and take these breathing treatments and let the awesome staff here take care of me and get me where I need to be, and I'll see you again in another segment later on. Okay, they're going to remove my chest tube, which I'm assuming is going to be very painful, but it's going to be a lot better once it's removed. So I just walked a few laps to loosen up, and I'm waiting on the doctor to come in and remove my chest tube. I'm going to try to see if I can get someone to video it to document it. Also, the little leak that I have, they said that my doctor reviewed it and he thinks that it's something that will rectify itself with a little more time. So they're still planning on sending me home Wednesday, which is day after tomorrow. That I won't be able to take anything by mouth until Monday when I come back and have another leak test done. So waiting now for them to come and remove my chest tube. And it looks like the leak is going to be nothing more than a nuisance, God willing. So I got to prepare for this removal now. Okay, so they got it out. I didn't film it. Didn't have anybody here to film it for me. Just got a dressing on it now. So really nothing to see. But I'll show you what it looks like now. You can see in the previous video what it's like to have the tubes coming out. The main thing is that the tubes are gone. Sorry, I'm having trouble with my phone. Tubes are gone, so that's the good thing. So I'm gonna go for a walk now and try to clear my head and my lungs. Okay, hey, day 5. It's about 7:20 in the morning. I got a little bit more sleep last night without having any severe episodes. Whenever I would wake up, I would need to move around and clear my lungs, but I wasn't so severe that it was gagging me or making me cough with horrible pain like before. So last night was definitely better. Met with the doctor this morning, and they seem pretty confident that I can get these tubes taken out of my chest today. So of course it's important that all of the leakage has kind of stopped, so that I'm not still leaking after they take the tubes out. So, but it's going to be a lot of relief once those tubes get out. I'm going to be able to swallow some stuff today, so hopefully that will go well. I've been having a little bit more gas, which is good. I'm sharing that with the staff here. You gotta laugh when you can, I tell you. And if you guys have been following me all the days, I'm in such a better mood than I have been the other days when I get up, because I woke up and I was still in a lot of pain, but I was able to get up and put my sweatpants on and go for a good 10-lap walk at a pretty brisk pace, and feeling better with the breathing now. I still do have a rasp that I'm going to need to work up and get that coughed up. Urinating was easier this morning also. So just all around getting better. The heat packs, when I stay in these positions, my neck gets so tense. They have these little snap heat packs that you can get, and that really helps a lot. So just periodically ask for one of those and apply it and make you feel better. At least it made me feel better. So I'm trying to think here. Yeah, they're going to do the test to make sure I'm not leaking, and I'm going to be drinking some stuff today, and hopefully all the tests go well. I plan on, being active today as much as I can responsibly, and we'll just see how it goes, and hopefully it'll go well. Day five. All right. Guess what? I just passed my swallow test. So 2 nurses came in. They took out this tube, this little lubricated tube. They fed it up my nose and into my throat so that they could see me swallowing. They had me swallow some ice first, and as soon as I swallowed the ice, there was a booger that got right on the camera lens, and they couldn't see anything. So they were like, yeah, you need to keep swallowing. You need to eat more ice. You need to keep swallowing. And I'm like, yeah, I did that on purpose, because I've been waiting so long to have some ice to eat. And, of course it was a joke. But finally, the camera cleared. And then she said, oh, everything looks good. She said, now drink like you're thirsty. Oh, and I got to just drink some ice water. Oh, it was so nice to be able to swallow something. And they said everything looked absolutely perfect. So praise the name of Jesus. Thank you, Lord. Thank you. Praise God. Thank all of you for your prayers. Thank everyone for their support, for everything you've done to help me and my wife get through such a difficult time. Thank all of you so much. There's been so many things that's came up that we couldn't do on our own, that we couldn't handle, and people just keep stepping up. They keep giving their time, they keep giving their money, they keep giving their prayers, advice, strength, support. Just thank you so much for everything, because I couldn't do this, wouldn't be here without all of you guys. Thank you. Whew, I want to celebrate with a nice glass of ice water, or maybe a Diet Coke. But all things in time. But I just wanted to share that with you, and still have some other exciting things planned today. Hopefully be getting this chest tube out. Day 5 is off to a great start. Yeah, I'm so excited that I was able to drink ice water that I forgot that I have one more test. This test was just to make sure that the water was going down okay, that there was nothing that they could see wrong before I actually do the barium swallow. So now they're going to come in and do the barium swallow and check for leaks. So, but I'm optimistic everything's gonna work out. So, just waiting. Okay, we are at the end of the day now, and it's about 8:15. I'm in a lot of pain, and I'm doing everything that I can to deal with it. I understand that they have to, break me down from the levels of medication that I was on before. They have an idea that they could possibly discharge me on Wednesday or Thursday. So they have to show that I'm coming off the meds. So this was something that I had tried so hard to prepare myself for, and it's happening exactly like I knew it would happen. Because when you've been dealing with chronic pain as long as I have, unfortunately, in my situation, this surgery has exacerbated my pain. So the doctors here at the recovery, they can't manage that effectively because of the way that everything is set up. They don't want somebody to try to say that they turned this hardworking father into a drug addict. So no matter what kind of relationship you have with your pain management provider, just know that when you go into that hospital setting, you're at the whim of a million dead addicts. That's just the way it is. So you just try to deal with it as best that you can, and don't take it personal, and try to stay positive. I'm taking walks. I've had like 50 walks today, just trying to work through the pain. I've done heat packs. I've done these other packs that are supposed to, lanacane patches. So I'm just trying not to think about it. I'm trying to move around and just try to deal with the pain the best that I can. Just in any situation that you're in, you have to take what you're given, take your resources, and use them to the best of your ability. And that's what I'm doing. And it's important for you to be careful with your conversations that you have when you experience this slowdown on your meds, because you don't want people to perceive you as some drug seeker or somebody who's, having one of these problems that they're supposed to watch out for. So unfortunately, you're going to be assessed. Every conversation, when they ask you how you're doing, they're actually assessing you. That's just the way of our medical world right now. And the people who are really suffering, they're the ones that's going to suffer. So I know this all too well. I've been dealing with it for over 10 years now. So it's not done to punish you, but it ends up punishing you in the end. Not everybody, but definitely in my case. So right now, I'll be able to have another dose of medication at 9:15. I'm going to be able to have like a fourth of a microgram of Dilaudid, or a fourth of a gram of Dilaudid. Anyway, it's a small amount of Dilaudid. And because I had it earlier today, and I didn't even feel it. It did nothing. So, but I'm going to be able to have that at 9:15, and hopefully that will ease things off enough that I can go to sleep. I'm trying now. I'm trying now to wear myself out so that when I fall asleep, that hopefully I'll stay asleep, because that's going to be the best thing for me, is to just to be able to fall asleep and stay asleep. So that's the end of day 5, folks. It's been a roller coaster. We're trying to come down off the pain meds to be prepared to go home. And we're trying to stay active to keep the lungs clear, do the breathing exercises. We're trying not to step on anybody's toes, to keep the staff happy. Staff is much more accommodating when they're happy. So keep your staff happy. And we'll get through this. We had the leak, but hopefully it will resolve itself. It's just going to take more time. I'm leaving the GoFundMe up because my wife and I, we still are depending on the kindness of others to get through this difficult period. It's going to be a long time before I go back to work. And I don't have a way to make money right now other than begging for it. It's not, stop it. It's not that way. I'm not begging. It feels like it sometimes. I'm very thankful for those who have helped us out. There's been so many people who've helped us through this difficult time, and I appreciate every one of you. Thank you so much. One day at a time. One day at a time. God will make a way. God will make a way. He always makes a way. God will make a way. So hopefully tomorrow won't be such a painful day. I haven't had a bowel movement yet, so I don't know how much that's factoring into things. I really hope that when they took out this drain tube that I wouldn't hurt so bad, but it's the same. I still hurt there in that area because they had to put the bandage on. They had to crimp the skin and put the bandage on tight because the suture would not work very well. So a little bit of bad luck there. But we're going to finish it out today. Thankful that we got through another day, that God has given us this day, and that we have another day, God willing, tomorrow. And I just pray that God will give me strength and peace, and that will let me sleep tonight. So wherever you are, I hope that you are having a good day and enjoy the day you have.